Welcome everybody to New to Medical Device Sales Q&A. And I hope you all are having a great start to the holiday season. I hope you guys are getting ready for Christmas. I hope you guys are all having fun. And I just want you guys to know I'm so excited about today's webinar because, again, the whole goal is always to come in here and just provide as much value. So if you guys are in, tell us where you guys are watching from, because it's always fun for me to see where you guys are coming from. A lot of times we get people from all over the world, plus, in cool locations. So I always love to see where you guys are coming from. So just put it in the chat. Would love to see where we have. Hopefully we got some warm places. We got some cold places. I was actually just back in the Midwest and it was about 9 degrees. The first day I actually got into Iowa, it was 28 degrees with 65-mile-an-hour winds. And it then turned into, I think, feeling like -1, which then reminded me why I came out to Arizona. So would love to see where you guys are from. But I just want you guys to know today's agenda and what we're here to do is, first off, just go over how we can help you guys break into medical device sales. What we're seeing going on in medical device sales and how we're able to help you guys. So again, if you guys just tell us where you guys are from, we will have people. So Amanda coming in from Detroit, Michigan. That's nice and cold. So hope you're staying, but I hope you guys continue just to get value and make sure that we can help you. Just so you guys know, we're going to be answering all of your questions. So if you have questions, make sure to go put them down in the chat as we will be getting to it. But I will be doing a little conversation of like what we see most people here wanting to break into medical device sales and what you can do to help yourself stand out. But we got Kelly from Maryland. Awesome. I've actually never been to Maryland. That's on my to-do list, but I have not been there. I've heard that it's absolutely beautiful. I've heard Portland, Maine is absolutely gorgeous, especially during the summer. So I will have to check it out. But today, guys, my whole goal is to help you learn what you can do to help yourself stand out in medical device sales, what you can do to be able to break into medical device sales, and how we've been able to help literally just today. Shout out to John. We just got hired well over 6 figures today, and really excited for him actually getting on a call with him here in a little bit. But actually, I'm looking at his offer right now because I actually just wanted to see it. And so as I'm on it right now, I'd love you guys to see. If you look at this at the very top, I'm going to zoom in. I'm going to go to start date. You're going to see start date is right here. And then you're going to see compensation. And you're going to see his compensation is $125,000. He's coming in with a base. And then you'll see below, he's also getting commission. So just so you guys know, literally do this every day as we're speaking. Just got someone hired with a base of 125K, but he will probably be making around 130, 135 plus all of the packages. And so the goal is, how do we help you all break into medical device sales, be able to stand out, be able to go through the interview processes and be the ones that are attaining the job. And so that's what today is all about. But before I go too much into detail, I want to go into just who I am because I want you guys to know why I'm even doing this. Just to give you a little bit of background, I originally am from Iowa. I wanted to break into medical device sales, moved out here, did personal training, but then was able to learn about medical device sales, went through the process of what everyone does is try to break in. Everyone tells you, hey, you should go get B2B sales experience. You should do A, B, C, D, E, F, G. You hear 20 different things from 20 different people. And then ended up just being able to go talk to people at the time that were actually venture capitalists. They were making a lot of money and they said, hey, I have a feeling you could do some other things that you don't have to do all of these things, because I was already selling myself in a lot of different other ways. I ended up getting 4 job offers: Stryker, J&J, Zimmer, and then I took a full line rep role with Medtronic. So I skipped the associate sales rep. And then I went in as a full line rep. I took the lowest performing territory in the nation to top 10. I was number 8, number 1 in my region. From there, I was headhunted, went to a startup called Innovis Medical out of the UK. I was one of the first 3 Americans. I then came in, closed one of the largest deals in company's history. And then from there, I then have New to Medical Device Sales, which we were running on the side. And at this point, we've helped over 2,500 people break into medical device sales. Our average person, as of 2025, is breaking in around $113,000. And so as you just saw, we just got somebody with a base at 125 grand. So that helps the average. But the reason I just say that is we're just here to help people. I've been able to help with thousands of people breaking in and being in this industry. We've had people, want to give a shout out to Amanda, who just won President Club winner at BD. We've helped people such as Seth go into the VP roles at startups. We've been able to go through those processes and only create a lot of great top performers. And then now, very proud to announce that we work with medical device companies. We help them place. We get a lot of companies reaching out to us looking for recruits, looking for people who want to break into this industry, looking for applicants, or looking to fill. Right now, we're currently filling in multiple different cities such as Orlando, Seattle. We're also doing San Antonio, Albuquerque, Austin. So again, those are just some of the places, but we're partnered with companies. So that's a little bit about who I am and what we do and why we do what we do. And so my whole goal is, how do we get you all who are watching to break into medical device sales? So again, just a reminder, I'm going to go through a little bit of questions and some common things that I hear and want to give you some education. But through that process, I would also love for you guys to go put your comments in and put questions that you have in the comments, because I will be answering all of those here in a little bit. So go ahead, drop your comments, and we will be able to answer those in a little bit. But first off, where do I start if I want to break into medical device sales? So just understand what I can start off with is, when you're wanting to break into medical device sales, most people think it's just like a normal job. It's, hey, I'm just coming in, I do an application or two, and I'm going to get an opportunity. What you have to understand is medical device sales is one of the most competitive industries in the world, that also is one of the most rewarding, because you're selling products that can truly change people's lives. And then on average, the average rep will make around $177,000, which again will put you in the top 10% of Americans. Plus, you usually get a car or a car stipend, your gas paid for. You'll get a lot of benefits with it, best healthcare that you can imagine, because you're in medical device sales, good 401k match, insurances, all the above. And so the reason I'm just saying that for you all is, you have to understand that many people want this. The average interview process is 5 to 7 interviews, 6 to 12 weeks long. And it can be over 500 plus people. And if you don't believe that, just go to LinkedIn. And a lot of times you can see that over 300 to 500 people applied for a job. And from there, what goes on is then they don't even know the differences between interviews 1, 3, 5, and 7. And then they don't know that each company a lot of times does them differently. And so you just have to understand, a lot of people want to break into medical device sales. They want to work with great companies. They want to have a good work-life balance, as long as you go to the right division, which we will talk about a little bit today. And that way, you guys can go sell a product that you believe in, go change your life from a work point and standpoint. And then you can also change your life from a financial standpoint. And the one thing I always want to put is, for some reason, many people get very touchy on money. We all need money to pay bills and live our life. So this is just a career that sales is known, if you do well, can change your life. But also in here, you're actually selling a product that truly does change a person's life. For example, I was just in the hospital with my dad this weekend, and while I'm sitting there, all I'm seeing is McKesson, Stryker, right? Cardinal Health, right? There's Philips, like there's all these different companies that are great, and you can be a part of that. So I want you all to think about that. So just understand, when you're looking at wanting to go into medical device sales, just understand that you can't treat this like every other industry that you've come in, and that you think that, hey, I'm going to come in and make $50,000, $80,000. Like, again, I just want you to have an understanding. One of our team members that were talking to a rep inside of medical device sales reached out to me, and he said, I didn't know there was an opportunity to do this. One of those reps that they talked to was doing $800,000 a year. Now, again, I will always tell you, that is not common. Don't expect to do that in medical device sales right away. And that is in the 1% of the 1%. And they work a lot, and they've been in it for a while, and all the above. But why I'm saying that is, there is the actual potential to do that, to work with doctors, to like get your travel paid for, to like make what the 1% of the 1% make. So you have to understand that. Then we can go into why applying is not enough. Because of what we just said, everybody would love to come into medical device sales and make a lot of money and have a good work-life balance and be able to talk with some of the smartest people in the world, such as surgeons, right? So you have to understand that you have to come in to try to stand out in that process. So what I'll just tell you is, number one mistake I see is people spending a lot of time just applying. They go on to company websites, or they see a job posted and they just go apply. But what most people don't understand is, you're going to go through the application process. You're going to spend all your time on the application process for it to just kick it back to you, because it's using AI. And unless you have the background that they're looking for, the B2B background that they're looking for, a lot of times it's just going to throw you out and you will either get a rejection letter within a couple of hours, or you might not get a rejection letter until they close that posting. And so it could be an hour, it could be 6 months. But you just have to understand there's so many better moves that you can do instead of just applying, because even if you just applied and you got an interview process, you're already behind the 8 ball, because now you're going to go meet with people and it's your first time and you're trying to learn as much. And there's not going to be a lot of people going out of their way to really help you, right? If you're just going for the first time and you're just saying, hey, what is this? What is your company? And if you just are looking up online. So just understand, applying, there's so many other ways to get into this industry. Now, that's where we talk about networking, right? So when we're talking about network, how do you actually network properly? The biggest thing is you're going to need LinkedIn. So I always tell people, instead of spending all your time applying and going to job postings, how about you take that same time and you go onto LinkedIn and you start reaching out to people. You start making relationships. You have prepared questions. You learn about their background. You learn about how they got into the industry. You learn about what made them interested in this, how they found out about the field. You learn about what their day-to-day is, and you go through that process. And so what I would have you guys focus on is really utilizing LinkedIn to make yourself stand out, but making sure that you're not just getting on calls to just say, hey, can you give me some advice? Or, hey, I saw a job posting in this city. Can you help me get there? Because that is a common mistake that we see. And it's what annoys the reps the most, is that most people won't do a lot of research before they get on a call with them. And then the only thing that they're doing is asking for a job. So I would just tell you, when we're going through that now networking process for you all, you really want to focus on making sure that you as an individual are doing the work so you can get people to think about you throughout the process of you breaking in. Hey, maybe they heard of a job, but do they think about you? And not because you just called and put an effort. Because I do want to put this out there. I'm hearing a lot of human beings where the number one thing I've heard from regional managers, senior territory managers, and reps in the industry is a lot of entitlement coming out. Just because you sent a message or you got on a phone call doesn't mean you're like special and should get a job, because that's literally square one of breaking into medical device sales and doing medical device sales. You actually have to show up. So that's what I would just tell you, is like, when you're trying to network and you're trying to get in that world, make sure that you guys are doing that research so you can get into that process. Then, how do you utilize LinkedIn correctly? So again, this is where LinkedIn is going to be your online resume. You absolutely need it, because the first thing that reps and managers are going to do is they're going to go look at you and they're going to go say, hey, this person sent me a message. Let me go look at their profile. So a couple things you can do to have yourself stand out, especially on LinkedIn. Number one, have a really good profile, right? You can want to have a good profile picture. You want to make sure that you're going through this process and that you're going to be, hey, they look at your profile there and know that that person's professional. Second off, take the open to work banner off, because you're coming into sales. You having an open to work banner on is not really showing that you're a hunter. It's more showing like, hey, I would like a job. And you don't want to be putting those vibes out right away. So I would say have a good profile pic. Then from that aspect, make sure that you have your about section filled out and that you have your online resume section, AKA your work history, all filled out and updated. Because once you do that, you're going to be in a good spot of people looking at you and seeing, hey, does this person have any transferable skills? Then once you have your LinkedIn utilized to be able to go reach out, connect with human beings, then we want to make sure that we're sending people messages. We're wanting to connect with human beings. One of the things you all can do on LinkedIn right now is, let's say you look up a company, right? Let's just say, for example, Stryker, right? That's one I hear all the time. So Stryker. Well, you can actually go to LinkedIn. You can search Stryker in the search bar. You can find the company. Then you can go search the people section at Stryker. If you scroll down, once you get to their company, you can search people, and then you can actually filter by the division, AKA marketing, sales, recruiting, whatever it is. And then you can actually even go a step further and you can actually go from the city. So you could actually look, hey, is there somebody in San Antonio or Tampa, Florida that works for this company? And so from there, that's where you guys will be able to take it to the next section of being able to then be more specific with who you reach out to. And then one of the things when you're sending out a message with everybody, what I would tell you to do is I want you to focus on not just sending out a regular message of saying, hey, I'm looking to break into medical device sales. Can I pick your brain? Or, hey, can I get some information? You actually want to focus on trying to make it as short and sweet to the point, and then adding your phone number. Because when you add your phone number, this is us teaching you guys to make the person you're trying to get on a call with, aka the prospect, their life as easy as possible. So, for example, when you're sending out a message, make sure that you send out a message, but you're actually putting your phone number. So when they see that, a lot of times these reps will call you what's called windshield time. They're walking out of a hospital, they're going to the next hospital, they're going to be driving from hospital to hospital or account to account. And so from there, that they can actually reach out to you. So make sure that you put your phone number in there. So when your phone number is actually in there, people will actually be able to just call you right away. And then from there, you can look them up on LinkedIn. You can have some pre-calls planning done. That way, when you get on a call with them, you're ready to go. Well, a big common mistake that I see is people not putting their phone number on. And then what happens is it says, hey, can we connect? And then that rep's actually going to respond back and say, yes, we could connect. But then what happens is then you're not ready. You might be busy. They were ready to connect with you that minute, that hour, that day. And maybe you get back to them a couple hours later, or you get back to them the next day. And now they sat there waiting, and you only get one shot a lot of times to make a first impression. And so what I would just sit here and tell you, make sure you put your phone number in there. Once they get your phone number, they can just call you when they're driving, and then you can put yourself in a really good spot. So when it comes to LinkedIn, that's like a really quick, easy way of make sure you have an updated profile. Make sure you're sending messages with your number in there. Also, you can actually reach out to people. And from reaching out to people, you can actually get specific on which company you want to be a part of or where they live, state, etc. So that's what I would tell you. Now, I'm going to go into the last piece of it, but this is where I would tell you guys, put your comments in the chat and wherever you're watching, just put your comments in because I want to be able to answer it. So we're going to do a live Q&A right after this. So any question you have about breaking into medical device sales or you're in medical device sales, like would be happy to answer it for you. So we will be putting those on the screen and we'll be able to answer those. So when you get a second, make sure to put those questions in and then we'll answer those. The last thing that we'll go over today is really how you're going to stand out to break into medical device sales and how you can actually come in to land a six-figure job in medical device sales. So the common thing that I always tell everyone, especially the people we work with, and as you just saw with John, who we just got hired at over 125 grand, is most people come in and they just try to ask questions and they try to actually just basically be, hey, I don't know anything and I'm asking you and can you help me? But if you really want to come in at well over six figures, what I always tell people is you have to be seen as a peer-to-peer. What does that actually mean? It means, have you done the research? Have you talked to other people at that company? Do you know anything about that company? Do you know the mission statement, the values, right? Have you talked to anybody in that same division? Do you have conversation that you can bring up about the products, right? So because many people, what they'll do is, let's just say like Stryker, like we mentioned earlier, you'll get almost Stryker reps. You don't know what they do, what specialties they're in, what's their competitors, right? You won't know anything about the actual division you're talking to. You want to know about any of their products. And it's just so easy to actually stand out. For example, go to ChatGPT. You literally can go take a company at Stryker and you could put the division in and you could say, hey, give me a quick summary of somebody I'm going to get on a phone call with and give me the top 5 talking points and products. And you could stand out very easily. But I will just sit here and tell you, as you go through this interview process, we need you guys to be able to show that you're doing the job to get the job. What do we mean by that? Is, hey, do you know how to prospect, aka going onto LinkedIn, finding people? Do you know how to cold call at your messages and getting them to respond back? Then when they have a meeting, do you know how to like actually run a meeting? What's the objective? What's the goal that you're trying to get? Then from there, are you closing them, right? Are you setting up another meeting, right? It goes into do the job to get the job, because no matter what your background is, you'll be able to show that you can do the process of it. And then they can teach you all the specifics at these companies, right? The companies are going to teach you everything that you need to know. You just need to know that they need to know that you're able to hustle and you're willing to hustle and you're going to go do all of those aspects of it. So that's what I would tell you guys to really focus on as you go through this process. And then once you've done that process of showing that you know how to do the job to get the job, it's what are you doing to stand out, to have yourself looked at as a peer, right? So again, if you're wanting to come in and just work all the time, 24/7, 365, make 55, 60K and work all the time, there's easy ways to do that. But if you're actually coming in here like John, right, who has a kid, he needs to be home. He needs a work-life balance to an extent. And he also needs to make a certain amount of money, which was over 6 figures when we started working together. We just accomplished that, but that was us coming up with a game plan on how are you going to stand out so you do get an offer for over 120K and make sure that you can have a work-life balance that can help you support you and your child. So that's what you all just need to understand is when we're going through this process is, do they believe that you can get a job and that you'll actually go perform? Do they believe that you've done your research, not just tell them they'll be good? Because that is one thing I can tell you as working with a lot of people and working with a lot of medical device companies. Every human being they ever talk to says, oh, I know I'll be successful, but throughout the interview process hasn't even showed that they would do that. They haven't followed up. They haven't reached out to other people. They haven't actually done any research. They're just like kind of winging it and they think that that will be enough. But you actually have to show that process here. And then when they're asking you questions, you're able to talk at a very high level. You're not just saying, oh yeah, I can run a tray. Like you're able to actually have a conversation that somebody in the industry who's been in the industry for 1, 2, 3 years could understand, and you guys could have a really good conversation. So those are the biggest things that I see for breaking into medical device sales at over 6 figures is you need to really learn how to stand out, and how to get yourself in a 6-figure position is by being a peer, not just, hey, can I run a tray? Or, hey, can you tell me about a job? Or, hey, I'm willing to work hard. Because at the end of the day, there's a lot of people willing to work hard, but if you're not doing the things that show, every time these managers and reps are talking to you, they're putting you in front of a doctor or a surgeon. And they're like, how would this person be reacting right now in front of that surgeon? Or the easiest thing I can even just say, we've had people who get a test of saying, hey, you're going to come in and let's see if you can come in to an interview. And they tell you, let's be there at 1. And they'll check it at 1:55 to see, or 12:55 to see if that person's 5 minutes early, right? And so again, it's just the little things that can come in, and are you doing that process? So those are the biggest things that I see people wanting to break into medical device sales. And so now I'm going to go and answer questions, but I just want you guys to come in and ask the questions that you have. Now, let me just put this person, here we go. So Mr. Robert, great to see you. So no question here. Jacob, you're the man. Helped me break in at over 6 years for MMS. Just had my first 10K month. So I just want you guys to know, these are absolutely my favorite. Robert's an amazing guy and came to us, wanted to break into the industry and got the results. So absolutely love to see it. And again, I just want you guys to see as he came in as an associate. So everybody who says, oh, you can't break into an entry-level role at over 6 figures, it's just simply not true. So hopefully that helps. But again, we're here to help answer you guys some questions. So if you have questions, drop them in the chat. But Rob, just want to say, great to see you, my man. Glad you're doing well. And hey, congratulations on your first 10K month. There's going to be a lot more where that comes from. So it's awesome to absolutely see. Nothing better than helping great people get into this industry and make a difference. All right, let's go to Kelly. So I'm a nurse wanting to break into pharma sales. Nursing interviews are very different than sales interview. Any tips? So Kelly, so just so you know, the guy I just got hired at $125,000 that I just showed at the beginning of this webinar is a nurse. Just to let you know, we've worked with a lot of nurses. We've got them hired a lot of the times at clinical roles. And so what I would just sit here and tell you is, yes, it's a very, very different role. I will just sit here and tell you, I've literally talked to hundreds of nurses. And let me just tell you, most nurses want to leave nursing because they feel burnt out. They're an hourly employee. They don't feel respected. They know if they want to make more, they have to work more overtime. They feel like they're capped. They feel like they're not appreciated where they want to be. Many times they're doing 1-to-1 or 1-to-10, right? Like your shifts, and they would like to do 1-to-many, and they want to get away from being just a 1-to-many person, and 1-to-1 person. They feel like they're meant for much more. And they want to make a living that's not tied to, I have to work overtime if I want to make 6 figures. So I just want you to know if that hits any of the pain points that you're on. I've heard it a million times, but going into how do you stand out? Well, here's the biggest thing that we always have to have a talk with nurses. Nurses usually will get a job because they have a certification, a heartbeat, and they can talk to people. There's a lot of times I've literally had people on our podcast. So if you haven't, go check out our podcast, New to Medical Device Sales, or our YouTube channel, New to Medical Device Sales, where a lot of times nurses have come to me and said, I got the interview or the job without even doing like an actual in-person interview, or I just did one interview and I got the job. You have to understand this interview process is not like that, right? Just to give you an idea, you can go watch the podcast. I would encourage you. We had Randy, who was a nurse of 18 years. He comes in, he's now at over 150K as a clinical. But what you guys have to understand is he has a $120,000 base, 30K OTE, right? So on target earnings. So he would be at a 150, plus he's going to get a car. He gets his gas paid for. He's also going to get all the insurances and all this stuff. So many people don't understand, like just in your packages, you're probably going to get another $15,000 to $30,000 depending on the package in the company. And so why I'm saying that is even if you got, let's say you make $85,000 as a nurse, but then you say you got in at medical device sales at $85,000, you're actually doing way better because they're going to pay for your gas, a lot of times pay for your cell phone, Wi-Fi, et cetera, stuff like that. So that's number one. Number two, when you're trying to go through the interview process, again, it goes back to how do you stand out through that process? How is your background going to be able to translate to these companies? A lot of times I'll just tell you, pharmaceutical companies, it can be a different process. We've helped people break into medical device sales, and pharmaceutical sales. We a lot of times go into medical device sales, and I'll just tell you why. Medical device sales as a whole, and this is not Jacob's decision, it's just as a whole, many times medical device sales doesn't like pharmaceutical sales. It's not a huge fan. For example, if you go look at some recruiters posting jobs, they will literally say pharma reps do not apply, right? So I just tell you that is they get told that they're not really selling, right? You're just going in, pushing some coffees, selling some samples, and then the doctor's going to go and get kicked back and blah, blah, blah. So the reason I'm just saying that is normally we push people to medical device sales first because you can still have a good work-life balance. You can actually use your clinical background. You can help people. You'll usually make more money and you'll have a better work-life balance. Like once you get established for the money piece of it, compared to, yes, you can probably have work way less in pharma, but your paychecks are going to be way different. And again, a lot of times it can be turnover related. So just want to put that out there. But when you're going through the interview process, I will just tell you, we have podcasts out there for free that I would just encourage you to go watch. We have helped a lot of nurses break into this industry. Again, Randy, you can go watch his podcast. Literally just got John hired. We have so many nurses on the podcast. But what you have to understand as a nurse coming into medical device sales is you trying to break in, it's going to be literally nothing like you used to do. It's not going to be able to just say, hey, I have this background, this certification. You need to understand the process, right? Like I said, on average, 5 to 7 interviews. But the thing that many people miss is most companies do them different, right? So I'll just give you an example. Medtronic, Stryker, J&J, right? On average, J&J will normally do an actual like online video set. Then you'll have a Stryker that will do like a Gallup test, like a personality test. And then you have Medtronic that does like a panel test a lot of times, or a panel, right? So the reason I'm just saying that is like, those are like differences that most people don't think about. And so you have to understand the game. And so what I would just tell you, Kelly, if it's something, feel free to reach out to me. Again, our team is always to help you. Like I also will be dropping some resources for you guys all here after this in a second that are free, that can help you. But I would just sit here and tell you for your interviews, they're really different. And you have to also understand, are you going to a clinical role or are you going to a sales role? Because for example, a clinical role, we have to prep our nurses way different than if they're going into a sales roles, because that's two different kind of people that they're trying to hire. A sales role is more type A. Can they go hunt, get all that piece, compared to like a clinical is going to be more of, hey, patient facing, right? We're going to be more about relationships, all that aspect of it. So if you have more questions, please feel free to put them in, but that's what I would just tell you in that aspect. Richard. So via AI and blogs, is it true 50 years old, even with a strong B2B sales background, have very little chance OTE to be hired regardless of certifications? Yeah. So, well, real quick, like possibly AI and blogs, I can just tell you from real human personal experience, here's the reality of it is certifications really don't matter too much, especially if we're talking about sales. 50 years, again, age really doesn't matter. I've helped people that are 50 break into the industry, that like Shannon Holly, she broke in, she was from radio, right? She had been in radio for 20 plus years. And at 49, she broke in to medical device sales and does very well, right? And so the reason I'm just saying that is a lot of times age isn't going to be like the factor, because again, just transparently, you can always use it. If you're younger, you're like, hey, I don't have a family. I don't have as much baggage. I'm more energetic, whatever it is, like that, you can use that. But for example, if you're older, you're more seasoned, you probably have more relationships. You're actually like have paid taxes before. Like there's all the ways to bring it, and it's how you spin it to yourself in it. But the one thing I'll just sit here and tell you is like when we're talking about with your B2B sales background, I will just sit here and tell you, the hardest people for us to ever get hired in medical device sales is salespeople, because they come in with all of, oh, I already have this background, or I have this. And then they get told by all these recruiters, all you have to have is B2B sales background. And then out of nowhere, they've been trying for 3, 6, 12 months and they still haven't been hired, right? Because they're looking for specific things. So Richard, I would just sit here and tell you, from whatever AI or blogs tell you, I would just tell you is you have a good chance, especially if you're B2B and you've been in B2B for a while and you've had really good experience and you're able to carry that over to medical device sales. Yeah, there will be a company that definitely will be willing to take a shot on you. But I will just sit here and tell you what I watch the most, especially with people that are 10 plus years of B2B sales experience. They think they're experts because they did B2B, but now they're coming into medical sales, which they've never sold to surgeons. They've never actually been in surgery. So then they try to tell the companies why they'll be so successful. But all, again, going back to what we talked about, you got to do the job to get the job, not just say you'll be so great, because every other person in your exact same shoes is going to say, I will be successful. I have sales experience, right? And the reality of it is most of you won't. And so you have to learn how to do the process. And then through that process, be able to show it, and then just use your background as a very strong anchor that you'll be able to use throughout that process. And so this is what I'll just sit here and tell you. Being 50 and B2B sales background, yeah, you could definitely get hired in medical device sales. There's going to be a company that could use that. They actually want a more seasoned, right? Let me just say this. There's been times I've been with startups that are like the founders are 30, 31, 35. They actually like getting an older rep because it adds more season, and from a perspective, they can bring them in. So there's a lot of different companies and a lot of different angles that you can play this at. What I'll sit here and tell you, age has nothing to do with it. Again, many times background has not much to do with it. It's going to be how are you prepping and how are you showing up in the interview process? Because the last thing I'll just say, why I would say age, like unless you're like 55, 60, and again, 60, 65, like just transparent. I remember being at one of my accounts. They had a guy, he was 67 years old. And they used him because he was available. He didn't have a lot going on. He was single at the time. And, he was always available to go to all the different cases around Phoenix. And so he was 67 and he was doing medical device sales. And so the reason I'm just saying that, is that common and normal? No. But like, again, the one thing I'll just sit here and tell you is the people who always struggle are the people who are telling me they don't want to be common or normal. And then they try to go do common, normal things. So I would just tell you, Richard, instead of like, you have a great background, you're 50, so you have wisdom and age with that. The biggest thing is, can you actually sell yourself to beat out someone who's 27 or 32 and who is hungry? Because you have B2B sales background, but what happens if that same person, because what you guys don't also understand is many times you're not just going up against someone who's from B2B, you might be going up at a role for Medtronic. And like when I was at Medtronic, we had somebody who came in and was a rep at another smaller company, right? So, and then when they did that, they already had medical device sales experience. They just wanted to work at a larger company. So you're not only going up against people who have B2B sales experience and aren't in the industry, you're going up against people who are in the industry. And the last thing I'll just say to that is, sometimes I say that and people are like, oh, then I don't even know why I try. And if that's your thought, then don't try. But the people we work with are like, yeah, that sounds exciting. I want to beat out because I know I can do this. And then we work with them and show them the way on how to do it. Again, just so you guys know, John, right now, no experience, was a nurse, just got hired as a clinical at $125,000 with, again, his OTEs, which I still have to look harder into. But the reason I'm just saying that is he beat out a lot of people with sales experience and clinical experience that were already in the industry, right? It's just when you know how to do the job to get the job and show why you're hungry and show that you know the steps and the processes, and then you do the stuff to wow them, you can be the person getting the offer. So that's what I'd say, Richard. Honestly, at the end of the day, AI, blogs, whatever it's going to be, if you have a strong B2B sales background and you know what to do, you'll be able to get into this industry. The biggest thing I'll just sit here and tell you is most people don't know what to do, and then they're trying to like guess. And then the problem is that they go talk to 20 different reps, and then 20 different reps give them all this background and all the stuff. And all I can sit here and say is everyone says, go get B2B sales experience. And literally every day we get people hired with no sales experience. And so it's showing that you just have to learn how to play the game with that process. So, all right, Amanda. So I've spent 20 years in management and retail with an authorized retailer for AT&T, and I have a BS in marketing. I'm very interested in getting into medical sales. Seems like my sales background doesn't meet the qualifications. What are your thoughts on getting noticed on how to sell my skills? So yeah, so Amanda, to that point, here's the biggest thing. Many times, if you're doing like AT&T and you're going to that place of it's B2C, they're not going to count it. And I just say this as somebody who was a personal trainer, who literally sold my own business, who sold my own services, had to train human beings to get paid. And it was all that aspect just to get told that's not sales experience, right? Because it wasn't B2B. Here's what I can sit here and tell you. We've taken plenty of people who have a very similar background, have had sales. You have to be able to turn that into how would that transfer into the role that you're about to go take, right? So they'll say, hey, have you ever sold to an actual company before? You might be like, hey, no, I've never sold to this, but, and then you'd be able to answer why you would be a good fit too. I can just sit here and tell you, you guys all have to understand the whole goal of a medical device sales interview is to tell you why you're not a good fit. And what happens is many of you will get told that, and then you go, oh, and then you feel bad for yourself, compared to what it has to be is, hey, even though you don't think I'm a great fit, here's why I'm a good fit, right? Or, hey, even though you look at that as a weakness, here's why I actually see it as a strength. And you're being able to turn that in, because there's always things that you can turn. For example, going back to Richard, if you're 50, again, I've helped people that are around that age get hired. So we can use that as a strength, but also I've held people that are 25 beat out people that are 50. Why? Because you use those strengths. So it's, and again, let me just make this clear. If you're 50, some people will love that, and some people will be like, you're too old. And same thing, if you're 23, we just got Alexa hired with Smith and Nephew at 22 years old. She had to come over the opposite of you're too young. So it doesn't really matter. They're always going to tell you why you can't do it, but you have to be able to come. So Amanda, for you and your background, you have sales experience. They're just going to tell you it's not the traditional background that they're looking for. And you have to be able to show why that background would still be relevant to the position that you're applying for, and why you would still be successful with it because of the background you already have. And again, showing that process as you're doing it, right? Not just saying, hey, I got 20 years experience, so I know I'll be successful. I'll be like, well, what have you been doing through this process to show us you will be successful? So that would be my encouragement for you. And then let's see, Landon. Can you break in without a degree? I have 7 years of experience in sterile processing and 1 year as a lead tech. So this is a very common question I get, Landon. The easy answer is yes. The biggest thing that people will always just see is what I always have to set expectations is many times you can't expect to get hired by the big companies right away, right? You can't expect, like, and this is what I would just say, you can still go work at those companies eventually. I know somebody at Stryker Neurosurgical who, again, Stryker Neuro, like they usually need a degree and all the stuff and blah, blah, blah. This person has a 0 degree, but very similar to you, they had a background working with these surgeons in the OR, and that Stryker took a shot on them, right? And started them as associate. But I'll just sit here and tell you many times those big companies won't, because even from an HR standpoint, you'll go in, you'll have all this great experience. You might even have relationships with doctors. And then out of nowhere, they'll just sit here and say, oh, you don't have a 4-year degree, so we can't help you. But I can sit here and tell you some of the companies I work for, like I know one of the big companies we're partnered with, they don't require a 4-year degree. So that's why I always sit here and tell you, most people that just haven't done the research and go this world, they'll always tell you, you have to have a 4-year degree, right? Again, let me just sit here and tell you, a 4-year degree will normally make your life easier for sure. But again, just because you don't have it, we've helped plenty of people with no degree break into the industry. It's just usually not at Medtronic, right? And so you have to understand that there are big companies that hire. Like we have 2 people right now with no degree in interviews with top companies, right? Like some of the top 20 companies. But I just always tell you guys, it's not normal. And there's going to be a dogfight, because even we've had people get all the way to the final just to have HR say, hey, you don't have a degree. Sorry, there's nothing we can do. The last thing I will just always put there with a big smile, I've also watched people with no degree and the regional manager, and then they made a good impact on the VP, and the VP was able to have HR look past the fact that they didn't have a degree, and they still got the job. And so what I'm sitting here telling you is everyone will tell me they can't get into medical device sales, or that you have to have a degree. And it's like, you need a degree until you don't, right? And if you meet the right people and do all of those aspects, it'll help you. So hopefully that can be helpful. If you guys have any other questions, I'm happy to answer those, because I'm, again, just here to try to provide as much value and be a resource to you all. But one of the things I'll do while we wait for some other questions is just some of the questions that I get asked a lot of times when people are reaching out to me. And I think one of the most common things I get asked is how much travel is involved in medical device sales. And here's the thing that I can easily say is it depends on the division and it depends on the company. So that's the tough part, is everyone wants me to give like a straight answer, but it's always going to be dependent. And why I say that is, for example, there's some divisions that only work in cities. So for example, here in Arizona, that they'll only be in Phoenix, because Phoenix is such a big market. There's no reason, because it's the biggest city. It's like the 5th largest city in America. So there's no reason to go outside of Phoenix and the metro area. So the reason I'm just saying that is for you all, there's some people who don't ever leave. And then there's, for example, I ran 2 states. So I had Arizona, and then I also had New Mexico. But for example, with my New Mexico, I only went out there usually on average once to twice a month, or sometimes it was like once every 6 weeks. And a lot of times it was just a day trip. I used to drive it back in the day when I had to get first going and bring equipment. But then I got to the point where I would just get on a flight that left at 7 or 8 o'clock in the morning. I'd get there at 10. I'd be there for my cases for 11 to 2 or 3. And then I'd be on a plane back home at 4:35. And then I come home. So it's just being able to monitor that. But again, there are some divisions that you won't ever leave the state. And then there's other divisions that, you might be flying like one of the people that we just talked about that makes over 800K. She runs a territory that's 7 states, right? So it's just going to be dependent on where you're at. So I think that's something that I would really have you guys all think about as you go through that process, because when you're wanting to break into medical device sales, I always get told, oh, I hear you travel a lot. I hear you have to like live on the road. That's only certain different companies and certain different divisions, right? Some divisions, like I know people who don't even carry trays. They just show up to the products or the hospitals and they already carry their products, right? We also work with a company right now. I have emails to actually get back to with a company that's such as like Cardinal Health, McKesson, Medline. They're not even in surgeries usually. They're just selling like the gloves or like, the scalpels or whatever it is, right? That you need, the hand sanitizer to the hospital. So there's plenty of opportunities you might leave your state. You might never leave the city that you're in, right? There's plenty of companies that are like orthopedics. They're just in the city. They're not even leaving because of their case. Now, again, I was with somebody who, they covered northern Arizona. So they would have Phoenix North, right? And then you can have other ones. But there's some people who I've also got told by some companies and some of the people we worked with, there's these associates that just get glued to 3 hospitals. And those 3 hospitals inside the city, inside this range, that's all they did. So they never left the state. They never left the city. They just went to those 3 hospitals and they just basically lived there. So just understand there's a lot of different options to go there. Let's see, got another one. So I was rejected by J&J MedTech at the final interview because I wanted it too much. That's the feedback from the hiring manager. So Lily, first off, a couple things. Number one, it's always interesting. I always just sit here and tell you guys, to everybody, this is why we always tell people to take everything you hear with everyone from a grain of salt. I can tell you, as somebody who helps hire with these companies, works with recruiters, helps all the above, has got many people. You have to always take what medical device managers and reps say with a grain of salt, because I can sit here and tell you a lot of times the managers and reps can give some of the worst advice, AKA like just go apply. and just so we're clear, when somebody tells you to just go apply, that's them saying, I don't want to talk to you and we'll let HR reject you instead of me rejecting you. Just so you guys know, like that's a little lingo that goes in there. Number one, but number two, Lily, like first off, that stinks. Unfortunately, that happens. The one thing I would just sit here and tell you, it's always interesting to me when you hear maybe something like that, because we just had somebody lose out at a massive medical device company, and like literally they met with the VP, and then the VP said, hey man, you're going to hear from us again. And then they end up passing on him because the role was for about 120K. It was an entry-level role, but they're like, hey, you're too talented for this. We know that you would get this job and that you would leave us in 3 months, 6 months. So we don't even want to offer you because we want to find something new for you. And the conversation I had to have with that member of our program was, it's always interesting because reps and managers will say that. But then the funny part is, hey, you're too qualified. You're too good. And if I hired you, you'd make me look too good to where even if you got to a spot within 6 months that you had to be promoted because you crushed it so well, which would only make me look good, right? Which would only make me look good. I'm going to have to pass on you. And we're not going to give you this job. And then we're going to try to go find you another job, which then if you're a top prospect, guess what? That person's already in the interview process with several other companies. They're not going to be around when that person comes. And so now they don't even take a shot on them. And then they lose out on them altogether. Right. And so I just want you guys to hear that, because this is why I smile and I laugh, because a lot of times things that get said make no sense. Is if you're just thinking about a business, my job as like a CEO or my job as a manager is literally to hire the best quality people. And if we can get them for cheaper, why wouldn't we? Because then that only makes us good and we got a deal and all the stuff. But like people don't think that way. So the reason I'm just saying that is that's unfortunate. But the one thing I'll say, I had 5 years experience with J&J in China, and now I'm in the UK and trying to get back in the med tech in the UK. So Yeah, so that's challenging part. Just so you know, this is really good for everybody to understand. Is also UK is going to run their things way differently. And what I mean by that is, again, I come from a company that was UK based, and so I got to talk with my counterparts that ran the UK territory compared to us here in America. And you just have to understand, Americans capitalism. We go for money, aka reps can make 200, 300, like that rep I told about, 800K compared to, you go over to the UK, it is not capitalism, and that reps are not making 800K. They're also not really like pushing deals and being able to like go land these massive. Usually you're going to be on the cycle, and a lot of it's by grants that they're going to get. And so it's just a different world inside of medical device sales. And so Lily, first off, again, stinks, but it is part of the world. But the one thing I would just sit here and tell you is everybody just has to always wonder and understand, like just always be interested of what everyone says, but also be careful of everything you hear, because many people will give you advice, and sometimes I would not take that advice. But again, Lily, I guess the last thing I'll say, and then if you guys have any other questions, you can put those in. Otherwise, I got some things for you all. But the one thing I will just sit here and tell you is, if the worst case scenario is you were too qualified and you did everything right, and the only bad part was you wanted it too much, I think if I'm in your shoes, I could probably live with that. Again, it doesn't change that you didn't have the job, but if that's the only thing that they can say to you, yeah, not too bad. So that's what I'll just tell you. And again, if it didn't work for them, go find, like, if J&J MedTech didn't work out for you, like, go find another company, because I'm pretty sure some other companies will really like you that you're in that aspect of it. So that's what I would just tell you as you go through this process, because we want you guys to always just be as encouraged as possible. And again, it can be challenging, but I will just sit here and tell you, sometimes it can be very, very challenging to you all to get into that piece. So here's the one thing that I will just sit here and tell you guys. My biggest thing for you all is we're here to help provide you guys as much value. We want you guys to get you to that next step inside of medical device sales. And so for us, every single time we're coming in here, we just want you guys to be able to learn. We also can send you guys out handouts. Just so you know, we have a handout that's literally got hundreds of medical device companies. It breaks it down by division. It breaks it down by revenue. It breaks it down by small, big, large, medium, right? All the above, because a lot of times you guys just don't even know where to start. So we want to put that in there. And then the biggest thing that I would also sit here for me, I want you guys to think about is, if you guys are really interested about medical device sales and you're wanting to break in, you want to learn how to stand out, you want to go through that process, I would just tell you guys is we are always here to help you. And again, we have members of our team that are just here to literally get on calls with you and see how we can help you through that process. And so I'm just going to be dropping a link down below. That will just be, again, it's our new to medical device sales page. Like, you guys can go schedule a call. Our team's always happy to get on a call with you just to learn more about your background, learn more about what you're doing, and also just learn more how we can help you in this process. Because the one thing I'll just sit here and tell you, many things that we hear is, I don't know where to start. And then when people don't know where to start, that's when it gets very challenging for everybody. And then the biggest thing for me is, what I don't want you guys to do is go through this process and then feel like you're stuck, feel like you don't have anything in that process to like get you going. And so just so you know, I'm just going to drop a link down below where you guys can come in and you guys can go fill that out. Our team can reach out to you. Again, our whole goal for this is just to be able to help you guys in this process. Again, and if you're interested in the handout for the hundreds of medical device companies where we put the top medical device companies all together, we can put that out there. But just again, if you guys are really interested in breaking into medical device sales, again, just literally showed it. We just got John hired at over $125,000. That was just his base. Again, you guys got to see Robert pop on, got him hired at over six figures. All we do is get people hired at over six figures. That's our focus. And the one thing I would just sit here and tell you is, like, if you guys are really interested in breaking into medical device sales, please feel free to click the link. But otherwise, I hope you guys continue to go after your dreams, go after the goals. Just know it's possible. Just again, most people just don't know what to do. That's why they struggle. And then they try to go figure it out on their own. And then the problem is, you go talk to 20 people and 20 people give you all this different advice, and then you don't know what to do. So that would be my advice to you all. But I just want you guys to know, we are always here to help you. We're always here to give you as much resources. The last thing I'll just tell you is, if you haven't, make sure to go check out our podcast, because we have a podcast that it can be extremely helpful for you all. It's called New to Medical Device Sales. And just so you know, this weekend we actually interviewed somebody we interviewed Angelo Mastrio, that is going to be coming out on Friday, and he is the vice president of Proverum. And so they just got FDA approved, and he has literally climbed the ranks of going from an associate sales rep to a territory manager to co-founding a company to selling that company to now working at that company for multiple years till it exited it again. And then they went to go be a vice president. And so he's going to share his journey. So the biggest thing I would just tell you guys is let's go have you go after your goals. Let's go make sure that you want to go and get the results you want. And the last thing I just want to put, because I just saw this come in, breaking in, bro, it's a sales gig. They take anyone with a pulse. That shows who we're dealing with and people who don't know what they're talking about because they've done their research. And so the reason I'm just saying that, this is why it's easier to win, because you have people like this who come in and say, I'm just going to do that. And those are the people we watched for 6 months struggle. So if you guys are really wanting to break into medical device sales, you know where to find us. We can always help you. But lastly, I hope you guys have a Merry Christmas, a Happy Holidays. I hope you go and have the absolute best week. And I hope you guys keep going after everything that you want. I hope that you achieve all of your goals. And if you have any questions, please feel free to reach out to us because, again, we are always here to help you break in to medical device sales. So we'll see you on the next one. And I hope you guys have a very happy holiday. I'll see you guys later.